This is LiveWell Talk on COVID-19. This is the weekly update. I'm Dr. Dustin Arnold, Chief Medical Officer at St. Luke's UnityPoint Health, Cedar Rapids. Some news coming up this week. The Omicron variant start to influence positivity rate. It's up to 3% in the United States, so predominantly it remains Delta. And we've seen that here at the hospital in that we have a consistent elevation of new COVID patients admitted to the hospital. Yesterday, it was 75% were unvaccinated, 25%, which is up. It had been about 15 were vaccinated, and 4 of them actually had a booster, but it hadn't been enough time since they've gotten the booster for it to be effective. We made the change this week to curtail outpatient elective surgeries and inpatient surgeries that require a bed postoperatively, and we've limited those surgical cases to ones that are urgent or emergent. But the Omicron variant continues to concern people because of the high transmissibility. But if you look at South Africa, they had no deaths, or maybe one death, but it was like single digits. So that is consistent with coronaviruses. As they spread, they become weaker. And I do feel that a little bit of optimism that the Omicron variant may be a sort of natural immunity, herd immunity sort of instigator, because people may get it and not get sick and have mild illnesses. This week, there was a FDA strengthened the warning of the Johnson & Johnson blood clot. I found this very unusual that they would do that. And I think knowing that the low platelets, the blood clots, and the possibility of thrombosis, which is a medical term for blood clot, with that vaccine, again, when you get a vaccination, you should sit down with your physician or your healthcare provider and discuss with them the risk benefits. And at this time, I would not recommend the Johnson & Johnson vaccine. With them strengthening that warning, that just elevates it to a concern where I would have a very low threshold to say, no, I think we should just stick with the Moderna and the Pfizer, the messenger RNAs. I did have some data in front of me as far as vaccinations. So for asymptomatic screening, so these are patients that have a vaccine, these are patients that are tested prior to surgical procedure to make sure they don't have COVID, right? And for unvaccinated, it is 5% positivity, meaning people just walk around and they think they need to have a surgery, or not that they need to have a surgery. It's not they think they need to have a surgery. And it turns out that 5% of them are unvaccinated. Fully vaccinated without a booster was 3%, and fully vaccinated with booster is 1.69%, 1.7%. Now let's go over symptomatic testing. Patients come to the emergency room, into an urgent care, in a doctor's office. They do have symptoms. They're tested. If they're unvaccinated, they have a percent positivity of 23%. Fully vaccinated without a booster, 16%. And fully vaccinated with booster, just under 6%. So you have, do some quick math here, you are 4 times as likely to get COVID if you're unvaccinated. And so the vaccine with the booster, particularly like we've talked about many times before in that high risk category, is certainly an advantage and does provide protection and prevents you from being in the emergency room and dying. And so in the hospital and dying. And so I strongly recommend that. Flu shots are available, and strongly recommend those, as I do every year. That's no different. But this year it's probably more important, as we talked previously, that there's a theory that since we didn't have a flu season last year, that we would have no carryover immunity, which usually happens each year, and so that we might have a worse flu season. Now, the first week we started measuring this, it was 13 cases in our lab, all influenza A. It doubled to about 24 the next week, and then it dropped back to 13. So we'll get another report on Monday, and let's hope that continues to drop and stay low. One of the common questions I get, or at least I think about, and also I'm asked, is that what's causing this number, this COVID increases, and I think it's factors of three things. The first is the Delta and the loss of efficacy of the vaccines to Delta. And then the second thing is the loss of the vaccine's efficacy or strength, if that's describes a situation. And then the third is I don't think you can overlook seasonality. This is a time of year people get sick, and the Thanksgiving holiday. And so with that, with Christmas coming up and the New Year's and people taking time off and going family, going to church services, I recommend for the Christmas that one, you get a vaccine with a booster, a flu shot, socially distance when you can, and wear a mask when you can, or when you're really in close scenarios that have poor ventilation, particularly traveling in a train or airplane or road tripping in the car. Those are the times that ventilation is so key. In addition to the masking and the social distancing, if possible, if ability to do such, is also wash your hands frequently and don't share eating utensils or drinking cups. And I think if those can be accomplished, it should be a merry season for all of us. Let's hope we don't have a spike in January. So with that, I'd like to wish everyone a Merry Christmas. To my Canadian listeners, Happy Boxing Day. And we'll have another episode of the Mailbag where I answer questions from our listeners. Welcome back to the Mailbag. Mailbag is a new segment or newer segment of the podcast where I'll periodically answer questions from our listeners on trending medical topics. Today, the questions are related to virology and COVID. The first question is from a listener named Rick. When was the first mRNA vaccine administered to humans? Is this technology new since the pandemic began? The first messenger RNA vaccine is the Pfizer followed by the Moderna. This technology has been around for a while, this amplification of messenger RNA to tell your body to do certain things. And I think it's really going to become a fascinating subject. And I really think it's going to influence medicine as we go forward and as my career starts to wind down. I mean, someday we may just give type 1 diabetic patients a shot, maybe once or twice a year, where they get a messenger RNA to tell their beta islet cells in their pancreas to make insulin and can actually cure their diabetes or for how to fight off cancer, et cetera. So it's fascinating technology, but this is the first time that it's been used clinically. I believe they did try to use messenger RNA for a dengue fever vaccination, and that had some nuances to it. And also, they've tried for decades to get an HIV vaccine, and I believe the early ones, I don't know if they're messenger RNA, but they actually made people more susceptible to HIV, so that obviously wasn't a great idea. But to summarize for Rick, that messenger RNA, this is the first time the vaccines have been used using that technology. Our next question is from Molly. What is the latest on the vaccine's effect on reproductive health? Molly, this continues to be a medical myth. We do not have definitive evidence that vaccines influence the reproductive health of the males or females, and vaccines are safe to use. I think it's completely reasonable, even though there's no indications that it may be harmful to the fetus, but there hasn't been any long-term studies. And I think it's completely reasonable to, if you choose not to do it while you're pregnant, I completely support that. But as far as recommendations from the American College of Obstetrics and Gynecology, they do recommend pregnant women receive the vaccine. The next question is from Bob. Is it true viruses get weaker over time? And are you seeing this COVID-19? Well, we mentioned earlier in the podcast that yes, they do. They should get weaker over time. Unlike the outbreak and these various other apocalyptic television shows where the viruses become more virulent and kill more people and zombie apocalypse, etc. That's not how viruses behave. Viruses that are very deadly, like Ebola, they tend never to leave the village because they kill people before they can spread it. And so this Omicron variant may be what we need as far as spreading natural immunity, okay, without causing significant illness. And so there is an upside to the Omicron variant that we didn't see with Delta. Early on in Delta, well, even now in Delta, we see individuals hospitalized and are critically ill, the unvaccinated, and at this time, it doesn't seem like we'll see that with the Omicron variant, which I'm cautiously optimistic that may play as a benefit to us. Our last question is from Virginia. Can you explain what monoclonal antibodies are and who is eligible and how it helps patients? Monoclonal antibodies are synthetic antibodies that are given to fight the virus, like the ones that your body would make. So we give an infusion of these antibodies, and they prevent the virus from attaching to cells and replicating, and subsequently let you fight off the illness. They enhance your immune system. That's a good way to describe it. Patients eligible are any patients that have over a 25 BMI, which is just about everyone, and are over the age of 12, I believe. It goes down to 12. And strongly recommended patients that are high risk for complications, chronic medical illness, active cancer, solid organ transplant, and those over the age of 65. We've been using this. We've actually, halfway through the month, we've done 200 this month. We do about 17 to 18 a day, 6 days a week. We don't do them on Sundays. And it's good to get them in earlier in the illness. So when symptoms start, you're eligible to receive it out to day 10. But one caveat is once you're on oxygen, once you're hypoxic and you need supplemental oxygen, it's not been shown to be a benefit. It's too late. You need to give it sooner in the illness. And so I think it has been a game changer as far as keeping people out of the hospital. And I strongly recommend it, and discuss with your clinician if you believe that you need it. You can always call 319-369-7211, which is the main number of St. Luke's, and get connected to the infusion center, and we'll help walk you through how to get set up with that if you are indeed eligible. And top of the hat, or congratulations to our emergency department physicians. They've been outstanding in getting people in as soon as possible. And Jeremy and his crew in the infusion center truly are healthcare heroes, and are simply amazing at how hard they're working and really, truly saving people's lives. And that's all for the mailbag today. If you'd like to submit a question in the mailbag, go to unitypoint.org/mailbag. I'll answer questions on COVID-19 or any other latest medical technologies, or follow-ups from previous podcasts, or clarifications, I should say. Please note, however, the mailbag is not an alternative to medical care. You should take your personal health problems to your primary care physician or clinician. And as always, if you are in an emergency, dial 911 or present to the nearest emergency room. Thank you for listening to the COVID-19 update. Merry Christmas. And as we said earlier, happy Boxing Day to our Canadian listeners. For the latest in COVID-19 vaccine information and more, visit unitypoint.org. Thank you for listening to LiveWell Talk On. If you enjoyed this episode, don't forget to subscribe. And if you want to spread the word, please give us a 5-star review and tell your family, friends, neighbors, strangers about our podcast. We're available on Apple Podcasts, Spotify, Pandora, or wherever you get your podcast. Until next time, be well.